Hello, it's Dr. Claire here, and today I'm going to be talking about lumps and bumps on dogs and what you should do if you find one. Finding a lump on your dog can be pretty terrifying, and I know a lot of owners are instantly worried, is this a cancer? And that's a very good question. And the best way to find out the answer to that question is to get down to your vet and have a consultation with them and perhaps do some diagnostic testing. The truth is, no vet can tell you with 100% certainty what a lump is just by looking at it. Sure, we can make educated guesses, but we need to take samples of that lump and look at them under a microscope or send them off to the lab to get a definitive diagnosis. When you visit the vet, they're going to take into account the dog's age, its breed, and its physical examination. And they'll make recommendations from there. There are a couple of ways to test a lump. One is called a fine needle aspirate, or an FNA. That's where the vet pops a needle into the lump there and then in the consult room in order to retrieve a sample of cells which they can either send off to the lab or look at them under the microscope. Alternatively, to get a more precise diagnosis, the vet will do a general anesthetic to get a good biopsy or remove the lump in entirety to send it off to the pathologist. The pathologist then sends the vet back a report with the exact diagnosis, and the vet can sit down with you to formulate a suitable treatment plan. Not all lumps are created equal. Some are more serious and others are nothing to worry about at all, like sebaceous cysts and lipomas. Sebaceous cysts are plugged up oil glands on the skin. They often rupture on their own and heal and are never to be seen again. Some sebaceous cysts, however, might get irritated or inflamed, and those may need to be tested just to be sure it's nothing more sinister. Lipomas are a very common mass that we find on dogs. Some people describe them to feel like water balloons underneath their skin. They're soft and rounded and non-painful to touch. These lumps are generally benign and nothing to worry about. Lipomas can be quite easy to diagnose in the consult room. We usually only surgically remove lipomas if they're getting too big or bothering the dog in some way. If only all lumps were as benign as lipomas and sebaceous cysts, we'd be happy. But unfortunately, they are not. Many lumps are malignant and so life-threatening. And that's why I always recommend diagnostic testing early on. That's all we have time for today on lumps and bumps. Thank you for tuning in.